Now for Should I Worry, our weekly segment about everything that worries us. So this viewer is asking, I occasionally experience what I've learned is an ocular migraine with vision disturbance. Should I worry? Dr. Siegel?
Well, I wouldn't worry. But what I think is you should be seen, and you should be seen by a headache expert, because, 15 to 18% of women suffer from migraines and 6% of men. It's an extremely common problem. And the viewer is pointing out something really important here. The migraine may just come in the form of an enlarging blind spot that's 20 or 30 seconds, or shimmers that you see. You may not even get the headache. It could be a warning that you're about to get the one-sided headache of a migraine, or you could get it without the headache, and that's an ocular migraine. Either way, you have to see an eye doctor, you have to see a neurologist. I believe that in most cases you even have to have an MRI to make sure it's not something else.
Could it be caused by eye strain?
Well, usually a migraine is a separate entity, and the aura of a migraine is what we're talking about here when you see the shimmers and when you have a visual change. Most of the time it lasts 20 to 30 seconds, and it can last longer, it can last several minutes. It is usually nothing to worry about, but again, get it checked out.
It's scary because you're driving behind the wheel and all of a sudden you see this blind spot in the middle of your eyes. Typically could be both eyes or one eye. Lasts about 30 minutes. It's harmless. It's painless. But while we're concentrating on this migraine, and it's called ocular or eye migraine for that reason, and there could be other things. You remember last week we talked about stroke and transient ischemic attack. You don't want to ignore this, because if you're having a mini stroke, that could present in the occipital part of the brain. It could present the same way. If you have a mass in the brain that pushing against the optical nerve, it could be doing the same thing. So yes, you want to pay attention to migraine by itself. You don't need a lot of treatment. You may go on for a long time and not having it. Usually it's early on in 20s and 30s. Women 3 times more than men. All the wrong stuff happens for some reason.
Hormonally related, because it's hormonally related.
Well, let's not talk about hormones, but 70% is genetics, and by itself can resolve. Now, something called prodrome, what that means is that there could be symptoms, signs and symptoms beforehand. A couple of months before, you may be feeling tired, feeling fatigued, getting some of the headaches. That's a way that you're getting the migraine. If you have the aura, that's when the headache comes with the ocular part and the vision, and
stay away. Medicines now to take care of that.
Well, before I get to the medicines, I do want to say that, like with the last time with reflux, we can do a lot by changing what you eat. No aged cheese. Chocolate can provoke migraines. Red wine can provoke migraines. Being dehydrated, being under stress can provoke migraines. Lack of sleep, really important. Then when you start talking about medicines, Eric, there are things called triptans that you can take before a migraine occurs that will abort it from actually happening. Those are really important. And we also use a lot of anti-inflammatory medications like naproxen, like Advil, like Aleve. That can help too. But it has to be with your doctor involved.
Right.
And I like
if it goes on for a long time, and I think you prescribed a lot of these, but probably there are antidepressant medications that once in a while works.
Absolutely.
There are also some beta blockers that we use for heart, but it would work for this also. Those are desperate measures. But, we like red wine, and I think red wine is also a big ticket when it comes to this.
Topamax is a great drug, and Botox is an emerging treatment.
What was the first one?
Topamax is a seizure drug that works. Topamax is a seizure drug that works, and for migraines that nothing else works for, Botox has been shown to be highly effective.
But see the ophthalmologist and find out what's going on with your vision. Don't ignore it. That's the more important point.
And those little blackouts are like 20 to 30 seconds, right?
Yes, but sometimes it can last even
several minutes.
Up to a few minutes.
Okay.
Yes.
Absolutely.
Right. Thank you.
Zigzag lines and flash.
Caffeine's good for migraines. I know from experience.
It can cause it
not
and
always.
treat it. Not always. David is right.
Okay.
Sometimes
you got to listen to the doctors.
David's right.